Friends, in this video, you can learn about analgesic, antipyretics, and non-steroidal anti-inflammatory drugs and important point for the exams. So this is a part of pharmacology. Let's start with the definitions and what is the meaning of these terminologies. So analgesic is also known as painkiller. So what is analgesic or painkiller? It will be used to relieve or reduce the body temperatures. This is nothing but the analgesic or painkiller. Then antipyretics. Antipyretics are the drugs which are used to reduce the elevated body temperature. And later on, non-opioids, analgesic, as well as the non-steroidal anti-inflammatory drugs. So let's see what are the non-opioids analgesic. It are the particularly suitable for relieving or management of the pain, which is associated with the musculoskeletal, as well as the opioid analgesics are more suitable for the moderate to severe visceral pain. So you know that these are the non-steroidal anti-inflammatory drugs. It can be having some examples like the salicylate and Nsaid. So let's see the important point for exams. That the non-opioid and non-opioid analgesics, it will be act as it will be having actions like in anti-inflammatory actions. So these are the examples like a salicylate example is aspirin and another one NSAID. So both can be useful to reduce the pain and inflammation of the chronic inflammatory disorders. So what are the chronic inflammatory disorders? This is the example, that is the rheumatoid arthritis. So this is the chronic inflammatory disorders. It can be affect the joints, including hands and feet. So in the rheumatoid arthritis, body immune systems attack its own tissues, as well as several severe cases it will be affect the its internal organs. For the treatment, salicylate and NSAIDs is mostly useful, but they do not alter the disease condition, or they cannot modify the disease condition. Hence, it will be required. Hence, there is required for the management of rheumatoid arthritis, that is the DMARDs. What is the DMARDs? It is nothing but the disease modifying anti-rheumatic disease. So it will be useful for the treatment of the rheumatoid arthritis. And then second one, which is the gout. So you know very well about that. It is the form of arthritis, and it could be the characterized by, it will be having the severe pain and the redness and tenderness into the joints, as well as you can find out the pain and inflammations occur where the, because pain and inflammation it will occurs because of, in this condition, uric acid crystallize. In this condition, uric acid crystallize and deposit into the joints, and it will be deposit into the joints, and hence it will be treated with the NSAIDs as well as the colchicine. Okay, so drug of choice for the gout, which is the colchicine. But the, if you want to treat the long term, okay, if you want to control the long term gouts, so it will be useful as a xanthine oxidase inhibitors for the treatment or the control of the gout conditions or the gout disease. Then another important point, that is the neurogenic pain. So let's understand what is the neurogenic pain. It is the pain due to the dysfunction of the peripheral as well as the central nervous system. In the absence of the nociceptor in the nerve terminal, stimulation by the trauma or the disease. This is nothing but the neurogenic disease. And let's understand what is a trigeminal nerve. Okay, so each of the fifth and largest pair of cranial nerves supplying from the front part of a head, its head, dividing into the ophthalmic, maxillary, and mandibular nerves. So this is nothing but the trigeminal nerves. And let's understand what is the trigeminal neuralgia. What is the terminal neuralgia? It is the chronic pain conditions affects the trigeminal nerves in the face. So that trigeminal nerves can carry the sensation from the face to the brain, and in the condition where as a neurogenic pains will be occur, it is the that particular the some drugs which can respond poorly, as like analgesic drugs could be the respond poorly to the neurogenic pain, and treatment could be difficult, and hence it will be used as carbamazepamines to treat this neurogenic pain. Then later on, it is important and the last point, that is the diabetic neuropathy and post-therapeutic neuralgia. So what is the diabetic neuropathy? It is one type of the nerve damage that can be occurs with the diabetes. Means the diabetic person, in the certain diabetic person, it will be having the nerve damage over there. So it will be occurs. That is the condition which mostly often affect the legs and feet. So this is the diabetic neuropathy, and let's understand what is the post-therapeutic neuralgia. So most common, it is the most common complications of singles. It is nothing but these conditions, oftenly nerve fibers or skin can causing the burning pain, and that can be long lasting after the rashes and blister of the singles. Means the chicken pox, that is the herpes virus infections over there. After covering, that will be the singles is nothing but the reactivation of the virus in the body. That will be nothing but the singles. And for that treatment of the post-therapeutic neuralgia, it could be useful as the amitriptyline, that is the drugs for the choice for the treatment of the post-therapeutic neuralgia as well as the diabetic neuropathy. So this is all about for today's video. Thank you so much for the listening this video.